the healthcare forum will bring people in the know about who is paying for healthcare in Garrett County and talk about issues that impact not only Garrett County locally, but surrounding counties and surrounding states. And with the facts, we can create better solutions.
And I think lots of people either do a political thing about it. You're for or against it, depending on who you voted for president. It's more important than that.
If you are in an accident or something suddenly happens, you're in the emergency room here, and they won't treat you. They have to, and they would want to. But then if you stay in the hospital for a while, you don't have the money to pay for it, and our hospital has to absorb the costs. And this is what they're saying is the problem for rural hospitals. They can't keep absorbing the costs. They will go out of business. And if this hospital goes out of business, it's devastating to the county, both in terms of health care, obviously, but also in terms of the economics.
And I just thought, if we could get together and understand it better, we'd all be better served. And fortunately, there's lots of good people in the county that feel the same way.
Yeah, the panel comprised of representatives from the hospital, from the health department, from local healthcare providers, is just going to be powerful in having us understand healthcare in Garrett County.
When I was coming up, everybody had a job that included healthcare, and unfortunately the economy has changed. And now there's so many people that either are self-employed or have part-time work or have jobs that don't have continuity or long life. And where I guess my thought before I looked at this carefully was, most everybody gets their stuff from work. Here in the county, 40% or less get their health care from what we think of as the traditional way. 60% get it from government supported programs. Programs that have been in place for a long time. And so we hold on to old ideas even though there's a new reality.
I mean, say it's a married couple and the one spouse needs to go into a nursing home. If it takes all of their finances to cover nursing home costs, their spouse is then left penniless. And if we do all these cuts to Medicaid, which covers 60% of the people in nursing homes, we're going to see many more people go bankrupt.
Oh yeah, Medicaid doesn't pay for that.
But you guys have.
Yeah, we have to. If they need dental, we do that. That comes out of our budget, and we come up with the money. Yeah. See, a lot of people don't know that.
Yes. We'll have community members of all kinds. It doesn't matter whether they are, what their political affiliation, what their education is, how knowledgeable they are on this area. We want everybody to come from Garrett County so that we can learn from these professionals who are in the know.
I've had breast cancer and stage 4 colon cancer. And if I did not have Blue Cross Blue Shield through my employer and now Medicare, I'd be dead, pure and simple.
Actually, I spent my whole life working with union workers. I was a labor economist with communication workers for 25 years. I worked for a couple of years with the mine workers. I worked at the Bureau of Labor Statistics. And so, in fact, my whole life has been focused around workers. And so I'm real aware of the individual effect of healthcare costs, either in a work setting or without work.
But there will be also an opportunity for dialogue and questions, and hopefully each of us who's in that room that night will walk away with more information, more facts, and a better understanding of the challenges that we all face together.
I'm thrilled to be part of this panel to discuss the topics of healthcare and how we all need to work together in a nonpartisan approach to come up with solutions around how healthcare will be rendered in rural America. We here at Garrett Regional Medical Center believe we have the model for rural healthcare in America today. Our Maryland payment system with the waiver presents our communities with a person-centered approach versus pursuing volume through episodic care rendered at our healthcare facilities. So I'm thrilled to be part of this panel, and I hope you will join us.